Well, thank you guys for having me. I appreciate the opportunity to speak for you. Today, this is not the first time you've seen this map and won't be the last, I'm sure, over the next couple days. But just for those that are unfamiliar with it, this is the map showing the prevalence or the proportion of each state's level of obesity classified by body mass index. And so the darker the color, the higher proportion of that state's population that's considered obese. So I want to talk to you a little bit more about this map. And this is the one that looks at the proportion of your state that is meeting the exercise guidelines. And so this is some new data from the CDC this year. And in this case, the darker the color, the better. So you want a higher proportion, of course, of your population meeting exercise guidelines. So what are those guidelines? You may not be familiar with them, so I'm going to tell you now. American College of Sports Medicine and a lot of other governing bodies have come together and using evidence-based medicine have shown that you need about 150 minutes of exercise per week to reap the benefits, the health benefits of exercise. And that's usually split up something like 30 minutes a day for 5 days a week. If you do exercise a little bit higher intensity, you can get away with just 60 minutes for the week. But either way, these are the recommendations based off of what these organizations say. Now, it has been stated that if you need clinically significant weight loss, you may need as many as 250 minutes per week. So it's quite a lot, and as you saw from the map, on average, most states, less than a quarter of the population is meeting those guidelines. So what I think we've come to sort of at least recognize whether or not we want to debate the evidence for this, physical inactivity can lead to obesity. But I also want to talk about the other side of this, in that if you're obese, are you less active? Do you exercise less if you're obese? Because we know a large proportion of our population is already obese. And so there is some good data looking at, if we look at activity of individuals over the course of a 24-hour period, is what this graph is showing. You have the obese individuals in the lighter gray bars and the non-obese in the darker gray. And you can see that the non-obese individuals over that course of 24 hours is significantly more active than the obese individuals. And so what I question for you is, what are the determinants of exercise? And why do some people exercise adequately and why do some not? And so there's a lot of great exercise psychologists that have looked into this. And I'll briefly touch on those. I think over the next couple of days, there's going to be a lot of speakers discussing these different aspects. So I'll kind of stick to the ones that are most relevant to my research. But there's personal attributes that may dictate whether or not you're going to exercise adequately. It could be something as simple as your personality characteristic. But what I'm concerned about or interested in is your physiology. Is there something about you physiologically that may determine whether or not you exercise adequately? What about the environment that you're in? I know we're going to have a lot of talks on this. And it could be something like your time constraints dictating whether or not you exercise adequately. What I'll speak a little bit about is weather conditions. There's been some evidence showing that if the weather is not ideal, you're not going to exercise. So if it's too hot out, like in Atlanta sometimes, you may not exercise. And the last one is the characteristics of the exercise. And so is it something about the actual exercise that deters you from wanting to do more of it or even continue that exercise bout? How hard does the exercise feel? If it feels very hard every time, you may be less likely to continue or to do that next exercise bout. So environmentally, just to touch on this, we've known for a very long time exercise in the heat is difficult. You're not able to exercise as long if you're in a hot environment. And so this is with athletes, but it proves to the point that your time to exhaustion, or the amount of time you're able to exercise, it is less if it's hot out. On the far right there, 31 Celsius, about 85 Fahrenheit. You're not able to exercise as long as 11 degrees Celsius, which is about 52 degrees Fahrenheit. And so this has been shown that the ambient temperature alone can be something that dictates your ability to exercise. What about the actual characteristics of that exercise? So we often use rating of perceived exertion during exercise. And this is a nice study looking at different environmental temperatures and different intensities of exercise. And on the x-axis, that's a marker of your internal temperature. And so independent of your intensity, independent of the environment you're in, how hard the exercise feels, or your rating of perceived exertion, is correlated to how hot you are. So if you're more hot, then the exercise will feel more difficult. And the last one that we'll spend the rest of the talk on is about the physiology and how your body's regulating its temperature. So the thermoregulatory system is our system that is trying to maintain an ideal body temperature. We usually are sitting around 37 Celsius. But to understand that, I'm going to explain very briefly how our system works in an ideal situation. We get a lot of inputs from not only the organs in the body, but also the skin. It's also giving our central nervous system or our brain a lot of feedback as to what's happening. And so your brain's going to make a decision about increasing skin blood flow, because if it does that, it can release heat to the body. It brings the hot blood to the outer core. And so we have increases in skin blood flow that help aid in the removal of heat from the body. And the one we often think about it with exercise is sweating. And sweating is obviously a very effective way for our body to control its temperature. We know that when the evaporation of sweat occurs, we're removing heat from the body, and so that's a good thing. Now, modifications of the system, as you would imagine, may lead to inappropriate increases in body temperature. And so in order for me to talk to you about this idea, we need to understand a little bit about how we measure the thermoregulatory responses. And so this is some of the things we do. I do human-based physiology, whole body physiology, and we can look at, for example, skin blood flow on the right there is a good index, laser Doppler blood flow, a good index of what's happening in the skin as far as the blood flow that's occurring there. On the left, you see there a sweat capsule, and so this is over, once again, on the forearm, and we can look at very carefully, and before the naked eye can actually see it, we can see the sweat occurring, and we can see that the computer will pick that up as essentially what happens is a dry air is moved across the surface, and as your body sweats, it picks up that humidity, and it's sent to the computer, and we're able to detect specifically when you're starting to sweat and how sensitive that response is, and also your maximal response. We also have some more mechanistic ways. This cartoon shows that same concept of looking at sweat rate, but now we can actually inject drugs under the skin. So a very small amount, very low concentration. And this sort of takes the brain out of the equation, and we can just give you a drug that actually mimics sweating or invokes the response of sweating or invokes an increase in skin blood flow. And so we can say for a given dose of a drug, do you have the appropriate response? And so this looks at this postsynaptic responses when we look at specifically right under the skin. We can also look at the number of, the top right there is the number of sweat glands. That's every one of those dots is a sweat gland. And so we can actually look at those and know how many sweat glands have been activated. So in order to invoke stress also, we can have people exercising in the heat. We have carefully controlled environmental temperature and humidity. We can also do passive heat stress, where on the right there you see two-blind suit, where we have hot water circulating, and you're able to very effectively increase body temperature. It feels okay initially, like a hot tub, and then it gets pretty uncomfortable. So the question at hand is, do people have impaired thermoregulation? So is there any evidence for individuals, and we'll of course talk about obese individuals, do they have some sort of impairment? And why is this important? Well, the hypothesis being that if you have impaired thermoregulation, your body temperature will be up higher than it would be otherwise. And so then you'll have increased fatigue. Hopefully I've shown a little bit of evidence there. I couldn't go into all of it for time's sake. But then the real problem or concern would be you're going to exercise prematurely, and then you're not going to be able to meet those exercise recommendations. And so there have been a number of populations that we know have some degree of impaired thermoregulation. They do differ depending on exactly what you're looking at, but there's some evidence for type 1 diabetics and type 2 diabetics having impaired thermoregulation. Spinal cord injury individuals may have this also. Multiple sclerosis has been investigated quite extensively, and that quote at the bottom is interesting because they've also started to make this link with these individuals that because they have this impairment, it may actually impact their ability to exercise, and they may have discouraging them from exercising because they have impaired thermoregulation. Skin graft individuals, we've been fortunate enough to look at a little bit more, and we know a lot about the mechanisms of skin grafts. So these are individuals that have severe burns, and they've had grafted skin now, and this grafted skin does not have the ability to sweat and does not have the ability to increase skin blood flow, our two main mechanisms of controlling body temperature. And so the consequence we found is that as you have a greater proportion of your body covered with these grafts, you have a greater increase in your core temperature. And so, of course, this is, we control all the other factors, including how much metabolic heat they're producing. And everything else being equal, we see the individuals with the greatest proportion of their body covered with grafts, 40 to 75% of their body covered. They have extreme increases in core temperature relative to their controls. So with obese individuals, we'll turn to this because, of course, this is the question at hand. There's been some very good epidemiological data showing that obese individuals have a 2 to 5-fold increase risk for heat exhaustion and heat stroke compared to non-obese. And this has been shown, a lot of these studies in military individuals. You'll see good evidence that seems to hold true, at least at an epidemiological level. And the consequence of this is that we've got a lot of medical manuals, a lot of position stands, a lot of anything coming out of the scientific literature that's being conveyed to the public is that obesity is a bad thing, and that your risk for heat stroke or some sort of impairment related to hyperthermia is bad, and obese individuals may heat up more. And so I think most of us may think this is something, we think of sometimes obesity creating insulation, and so you're going to heat up more. But if you look very closely at the data physiologically, and when we control these things in a laboratory setting, it's quite striking. There's really not good evidence to suggest this. We have no really good evidence saying, yes, when we control everything else, obese individuals heat up quicker. And this has been discussed because it may not be that there's a lack of a physiological difference, but it may be just the way we're looking at it. And so there's definitely some moderating factors when we try to figure out this in the laboratory setting. And one of the main ones is controlling your metabolic heat production. And so if you have two individuals exercising on a treadmill and you're going in the same speed, the heavier individual will have to do more work to do that speed. They're moving more body mass. And so they're going to actually produce more heat. And so their body temperature may be higher just because they've done more work, not because they have an impairment in the physiology. And so that's something that we have to carefully control, and we're able to do in a laboratory setting. We can have individuals exercising at the same metabolic heat production. We also can take other things into account and say, well, obese individuals have a larger skin surface area. And so maybe they actually have some advantages because they have more avenues for heat loss. So we have to take that into account also. And the other one that we look at is hydration status. Obese individuals may have differences in sweat rate. And so if they're getting to different levels of dehydration, that may be an independent factor as to why we see differences in core body temperature. And so we have to account for these sort of things when we look at them in a lab. And recently we've done this. We had young, otherwise healthy females, obese and non-obese individuals, while controlling metabolic heat production and hydration status, we had them exercise in a warm environment. So in one of the trials, when we had them exercising in an absolute fixed heat production, that's what the FHP stands for, so all individuals are exercising at the same metabolic heat production, all producing the same amount of heat. Over 60 minutes of exercise, you can see their body temperature goes up, but it doesn't seem to go up depending on what group you're in. So obese and non-obese individuals, there was no difference between the groups as they exercised. Do note that the change in body temperature is actually relatively minor. This is a low exercise intensity, and I think that has some implications for future research and whether or not there may be differences between these groups. This was the second trial looking at now, we accounted for the fact they had different amounts of body surface area. And so we made their metabolic heat production relative to their body surface area, and we saw similar findings in that there was no difference between the obese and non-obese individuals. As they exercised, they had similar increases in core body temperature. And so this is sort of a summary. If we look at the change in the different conditions between the obese and non-obese individuals, we didn't see a difference, and that's okay. I think there's a lot more things that we need to consider. So we did conclude that when we control the metabolic heat production and hydration status, these young obese and non-obese females did not have any differences in their core body temperature response. They had similar responses. But as mentioned, I think there's definitely room for further research because we often think of obesity in different avenues and different settings as people are exercising. And I think one of the big things is to consider the exercise intensity. And perhaps it's my analogy being, a Honda and a Ferrari at 20 miles an hour, everything's fine for everything. But when you're at 100 miles an hour, you may see differences. And so I think that's something that we can perhaps use and look at in these different individuals and see, is there actually an impairment in that physiology? So I leave you with this sort of paradigm that is really just an idea in the sense of if you begin to exercise and you have some sort of impairment in thermoregulation, and the far right black circle is all the different populations we talked about, diabetics, spinal cord injury, MS. Perhaps you stop the exercise earlier because you've got an increase in body temperature that's inappropriate. And then perhaps you have a decreased motivation to continue exercise over a long period of time. You're not meeting the recommendations. Your physical fitness will be lower. And then, of course, you'll be at increased risk for disease and all-cause mortality. So, of course, my acknowledgments. I want to thank funding sources. The University of Arkansas has done a fantastic job helping getting our research going, so I appreciate that. And then my disclosures about other funding sources at the bottom. Thank you for your time. Everybody's getting hungry.
Very interesting. I wonder also if anyone has studied the influence of the amount of work, the amount of metabolic work on motivation to exercise as opposed to the heating. Is there a perception of the amount of metabolic work being done?
Yeah, it's hard to splice out because exercise intensity alone will really be the main determinant of how hot you get. So even if it's a cool day out, if you exercise harder, you'll get more hot. And so, it kind of goes to this adage of, well, is it better to go a little bit slower so you don't heat up as much? So I think that not only perceptually, but physiologically, I think we could argue that, yeah, the intensity of exercise probably does matter. I think, unfortunately, I'm sure there's some great personal trainers out there, but there's others that they do too much too soon, is maybe sometimes people's opinion. And so the intensity really drives people away because it's too painful and just uncomfortable.
Hi, I was wondering if you think that states in the South, like Mississippi, if the climate has something to do with raised body temperature and increased obesity?
Thank you. It's a great question. And so, yeah, in fact, there's been some talk even, not only in the South, but this idea of global warming, perhaps having implications for people exercising outside. And, I will say there's been some other good epidemiological data showing that ambient temperature definitely is a determinant for physical exercise. I don't know if that same link, though, has been made specifically to being more obese. Part of the concern, I also study heat illnesses, is we live in environments where we're often in air conditioning. And so people aren't used to the heat. And this causes not only a health problem in athletic settings, but also if you're not used to the heat and you decide that one day you want to start exercising more, it's 100 degrees out, that's probably not very encouraging for the future days. So perhaps, but it's too early to tell.
Over here.
Yes.
Interesting. So there's a fair amount of data that there's alterations in the autonomic nervous system in obese patients. I was just wondering if that played a role in some of the mechanisms behind these sweat changes.
That's a great question. So, well, we know with multiple sclerosis patients, their issues with their nervous system is probably one of the reasons why they're having issues with sweating specifically. I'm not aware of the evidence with obese individuals. We're undertaking these investigations to see if these very specific mechanisms of sweating are modulated in the obese individuals. But I think depending on the results of those, we could trace it back to perhaps some dysfunction in their autonomic nervous system. Thank you.